I am Aruna Srivastava, working since 1983 in NIMR. My primary interest is in GIS, that is Geographical Information System, for decision support of malaria control. But present thrust is on HIA studies. HIA is the assessment of adverse health impact of a development project on a community. Presently, we are working on health impact assessment of Narmada basin dams, resettlement and rehabilitation colonies in Madhya Pradesh. In India, it is the first longitudinal HIA project which is operational for about 15 years now. HIA project started in 2004 in ISP dam components and SSP impounded areas as phase 1. Survey was conducted by NIMR headquarter team in pre-monsoon, monsoon and post-monsoon season. In phase 2, that is during 2011 to 2016, a total of 30 dams were included with 3 field units at Bhopal, Jabalpur and Narmada Nagar. MOU was signed between Narmada Valley Development Authority, State Health Department and NIMR. Presently, in phase 3, which is from 2016 to 2021, a total of 20 dams components and 22 districts are taken in this study with field units at Bhopal, Indore and Sanawat. The mandate of the project is to assess the adverse health impact of dam components on incidence of malaria and other vector-borne diseases, identify the risk factors, and to assess the quality of drinking water in terms of microbial contamination, suggest mitigating measures to stakeholders. First line of action is to identify risk factors, mainly engineering problems, promoting larval breeding sites and ban mosquito contact. Main problems identified were dam seepage, seepage water creating pools and pits, damaged canals, seepage and vegetation growth, construction of labor colonies, close to permanent breeding sites and uncovered construction material, etc. Mitigating measures were suggested for each problem and most of these were implemented by stakeholders, such as stone and debris were removed, seepage water was channelized into canals and streams, leveling of ground to remove pools and pits, plastic lining of walls during construction, repair of canals, deweeding, construction of labor colonies 1.6 kilometers away from permanent breeding sites, etc. Stakeholders also helped in release of larvivorous fishes in ponds and wells, spray in problematic villages and RR centers, cleaning and oiling of drains, fogging in powerhouse and other official buildings. Besides this, there are more problems like community unawareness about protection methods, water storage habits, migration in and out due to work. To counter these problems, IEC activities were carried out by NIMR with the stakeholders, like distribution of pamphlets among villages, health camps, lectures in schools, slogans were written on the walls, Nukkad Natak are performed, rallies are organized. Asha and Anganwadi workers are also trained during this study. As a result of health education, source reduction is done with community participation. Drinking water is tested using high media kit. Reports are being sent to State Health Department and villagers are also made aware of unsafe water sources. To evaluate impact of intervention, entomological and epidemiological surveys are carried out. In entomological surveys, larval and adult density is monitored. In epidemiological survey, fever cases are examined for being positive for malaria using blood slide examination and RDT kits, and reports are sent to the State Health Department and given treatment. After each survey, meeting is held with the state health officers to brief about the malaria situation. An information system has been developed to receive near real-time information at an IMR headquarters on GIS platform. Information of each positive case can be popped up at the click of the mouse. NIMR is working on GIS for decision support of malaria control since last 28 years, and GIS is found very useful for data analysis and interpretation. If we look at the impact of mitigating measures, we observe reduction in malaria cases after intervention taken by stakeholders and community participation, reduction in vector density. No other vector-borne disease except dengue have been reported in such study area. Due to early intervention, outbreaks and epidemics were reverted. No death reported due to malaria in the study area. As an expression of appreciation, NVDA put a jhanki of NIMR work on 26 January at Bhopal. I would like to express my sincere thanks to Dr. B.N. Nagpal, who initiated the project and took it a long way. Now the PI is Rekha Saxena, and I wish to thank each and every member of the group, and I also would like to thank the entire field staff for their sincere and hard work.